Not sure if your pelvic floor is healing the way it should after having a baby? Well, we're going to talk about 3 signs that tell you it might be time to pay a little extra attention to this part of your body. Sign number 1, leaking urine. If you leak even a few drops with coughing, sneezing, laughing, blowing your nose, picking up your baby, this is a sign that you might have pelvic floor weakness and it needs attention. Now, in the early days, it's really common to leak a little bit, but it's not considered normal, especially as you get on to week 3, 4, 5, and certainly by week 6, if you still have leakage, it's time to see a pelvic floor physical therapist that's trained in helping you to get rid of the leakage. Because here's the key. If you don't take care of it on the early side, after your initial healing, what tends to happen is over time, things start to worsen. So that's sign 1. Sign 2, pain or heaviness. So another really common thing after having a baby is feeling heaviness down in your pelvis, especially when you've been up on your feet, holding your baby for a long time. Being on your feet towards the end of the day is a really common time to feel extra pressure. So extra pressure in this area can be a sign that there's some weakness in the pelvic floor. And because your abdominals are probably weak after having a baby, they might not be doing their job either. So that's another sign that it might be time to get some assistance to help take care of this part of your body as you're healing. Okay, sign number 3, pain. Pain can come in a lot of different ways, but here's some common ones. Pain with intimacy, pain with bowel movements, pain, just general pelvic pain. We already talked about pressure, but even just pelvic pain itself is another sign that you might need some extra attention for this part of your body. Now, all these problems are super common. Okay, many women have a lot of these problems after they have a baby, but common does not mean normal. It is not normal, in fact. So after your initial few weeks, after that initial healing gets started, and certainly by your 6-week appointment, when you go back to your healthcare provider, to your OB-GYN or your midwife, these symptoms should be gone. And if they're not gone, it's really time to seek out help of a pelvic floor physical therapist or another healthcare provider that really knows this area of the body to help you figure out what it is you need to get your pelvic floor and your abdominals and your whole core back in line so you can feel great after baby. Because it's really important to correct these symptoms early on. And I know you're busy. I know you have your baby. You might have other children at home as well. You might have other responsibilities as well. So it can feel almost impossible to fit in even another appointment for yourself. It's worth it. You are worth it. The earlier you take care of some of these issues, the better off you do your entire life. Because if we ignore some of this early on, we start to get used to it and we start to live with these symptoms, and they tend to slowly snowball over time and get worse. So take a pause, take a little time for yourself, and start to get a little bit of assistance in this area. It might only take one visit. And in fact, like myself, I treat via telehealth. So you can find someone like myself that treats via telehealth. You don't even need to leave your home. The other thing you can do is you can check out, I do have some online courses. So if you're somebody who's a real go-getter on your own, there are some courses that you can check out to see if that might be helpful to help you heal as well. So congratulations on your baby, and just remember, you're worth it too. So if you need the assistance, just reach out.